Correlation between viral load and symptoms of COVID-19 patients. Currently available RT-PCR methods for the diagnosis of COVID-19 can give an estimate of the viral load. The cycle threshold value of the PCR correlates inversely with the viral load. Low CT values indicate high viral loads and vice versa. Higher viral loads have been seen to correlate with disease severity and infectivity. Therefore, we studied the correlation of the CT value of RT-PCR and the most common symptoms of COVID-19 individuals. Our hypothesis is that viral load correlates with the severity of COVID-19. In addition, viral load it is one of the factors that influence the variability of the clinical picture. We include 657 subjects in the analysis with a median age of 36 years and a male predominance of 72%. Of these, 60% were symptomatic and the mean number of symptoms was 2. The most predominant symptoms were headache, cough, and myalgias. When comparing between symptomatic and asymptomatic subjects, a symptomatic patient had a higher CT value in both genes, a younger age, and male predominance. With the symptomatic group, we compared the presentation of each symptom individually versus those who did not present that symptom. We found that CT value in the gene N were lower in headache, cough, and fever, and higher in anosmia and ageusia. Regarding the CT values in the gene E, they were lower in headache, cough, and fever, and higher in dyspnea, anosmia, and ageusia, and diarrhea. The rest of the comparison are shown in the table 1. In conclusion, we could demonstrate the correlation between CT values, acute viral load, and the presence or absence of symptoms during COVID-19. As far as we know, this is the first time that the correlation between viral load and the frequency of the most common symptoms of COVID-19 has been reported. Within the group of symptomatic patients, we found that viral loads are higher in the most common symptoms, such as headache, cough, and fever. In contrast, lower viral loads are correlated to less common symptoms, such as dyspnea, diarrhea, and alteration of smell and taste sense.